All right, 6:48, and we are joined by Dr. Alex Harrison. And this morning we were talking about heart health when it comes to children. Some new recommendations are out.
For cholesterol, right?
Yeah, within the past year or two, the American Academy of Pediatrics changed or updated their guidelines for cholesterol screening in children. And that was met with some controversy. But then a recent study published last week suggests that perhaps it should go even further. Currently, the recommendations are that children between the age of 2 and 10 who have a family history of early heart disease in either a parent or a grandparent, meaning a heart attack or a stroke before the age of 55, or they are deemed high risk due to diabetes, obesity, or high blood pressure at a young age, should be screened in that 2 to 10 range. And that was met with some controversy because the thought was that if you screen a lot of these people, you're going to find some high cholesterols, and a lot of study has not been performed in terms of what to do. The safety and long-term effectiveness of some of the cholesterol-lowering drugs has not been studied in children extensively, and so that was met with some concern and criticism. A recent study published last week looked at 20,000 fifth graders in West Virginia, so 10-year-olds, and they screened everybody, regardless of family history or their risk profile, and they found that 10% of the children who would not have met the current screening guidelines that and need to be cholesterol tested had elevated cholesterol, and 1 in 5 of those people that did have elevated cholesterol met criteria for therapy with medications. And so this raises questions: should everybody get a cholesterol test at some point in their early childhood? And it's unknown, and it has to do with, like I talked about earlier, the risk of long-term therapy with medications. Not being a pediatrician or a pediatric cardiologist, I definitely support the testing because I think it's important to know your cholesterol. Like I've mentioned before, it's important to know your numbers, and can be driven in terms of lifestyle change, increased activity, better dietary habits, and under special circumstances where you have a genetic defect and you have very high cholesterol levels, perhaps then therapy should be initiated early on.
And it would help to know that early for parents to be able to address that, something they may not be aware of. Now, for parents who maybe have some concerns, who are thinking, well, we have a family history or, what have you, what can you suggest as far as, things you can start doing right now to change your child's diet and, whether you have a problem or not, just kind of err on the side of caution? Yeah,
well, there's a big movement, especially with the childhood obesity problem becoming more and more epidemic. Kids need to get out and be active, and they need to play at least 60 minutes every day. So 7 days a week they need to get out and play and be active, play sports, do whatever, but not just sit at home and watch TV or play video games or be on the computer. So the biggest thing is activity, and then also a healthy lifestyle, and not eating high-calorie fast foods and junk foods and things like that, and eating more sensibly. And those are the obvious biggest recommendations. But if you have a genetic predisposition or a genetic defect that has extremely high cholesterols, the lifestyle changes often are insufficient, and drug therapy is needed.
You would need something more aggressive than just changing your daily habits.
Correct.
Now, Patty and I sit up here and read health stories every single day, and I can't tell you the number of stories I've read about a drug that was tested and then put out, and then all of a sudden they find it causes a bunch of different problems. It seems to me like testing children at this young of age, when we don't know what sort of a role cholesterol plays for that age group, and then issuing some sort of drug therapy seems like exactly what the drug companies want, but then we have these other side effects that then Patty and I read about all the time, and we're subjecting the children to that at such a young age.
Exactly, and so that's the unknown and the criticism, the other argument. And I agree that drug therapy should be initiated as a last resort, especially in children. And it probably should be studied more closely in the kids that really do need it. And those are the ones where I was mentioning, the genetic defect, where your cholesterol levels are so high that you actually get cholesterol deposits in your tendons and in your eyelids, and can get very long-term consequences if untreated. And when you have those patients that definitely need it, you can follow them long-term with the safety of these newer medications, and perhaps decide whether they can be used more liberally in other kids who don't have the genetic defect but are at high risk for problems down the line.
Now, there's two types of cholesterol, right? Good and bad.
Correct.
And one of them you actually kind of want to be elevated, right? And the other one you want to be low. How do you know which one's which?
Well, you look at total cholesterol, and then there's the subfractions of the cholesterol. The LDL is the bad cholesterol. The HDL is the good cholesterol. HDL helps clear cholesterol from the body back to the liver to be removed or processed. And so there can be a genetic defect where you have a very low good cholesterol, which is a strong risk factor, as well as a very high bad cholesterol. And it's important that you bring that up. I just had a partner of mine, we were discussing a case, a gentleman who had a strong family history of high cholesterol, but his dad was okay, but both his grandfathers had early heart attacks, and he was reluctant to start therapy in his early 30s. Right. And his cholesterol was checked, and his total cholesterol wasn't bad, his bad cholesterol wasn't terrible, but his good cholesterol was very, very low. And he says, well, you know, my dad did pretty well, and so it was helpful to have his dad's cholesterol, and his good cholesterol was actually high normal.
Right.
And so we could say, hey, well, it skipped a generation.
Yeah.
You probably have your grandparents' genetics, unfortunately, and you may be on a fate closer to theirs if you don't get this addressed.
So the numbers really do play a...
So knowing your numbers is important.
As you always say, know your numbers.
Yes.
Exactly.
Dr. Harrison, thank you for being here this morning.
My pleasure.
We certainly appreciate it. You can always get in contact with him morning rounds at KCOY.com.
That's right. And at 6:55, we're back in just a moment.